The broadcast is now starting. All attendees are in listen-only mode.
Hello, welcome to HDSA's Caregivers Corner webinar series. This is Jane Kogan, HDSA's Education Advocacy Manager. Today I am really excited and we're going to be talking about long-term care, and we are going to be hearing from Seth J. Meyer. Before I invite Seth to begin, I'm going to go over how to ask a question, as well as how to access this broadcast after the presentation. You can ask a question at any time by going to the right-hand panel on the side of your screen, typing in your question and hitting send. Seth will be answering all questions following the conclusion of his presentation. This webinar will be available for view about a week after broadcast. The slides will be available as well. To access the webinar, go to www.hdsa.org/ccorner. You can also find it in the Living with HD section on the HDSA website. You can find HDSA Lunch and Learn webinars at www.hdsa.org/ll. Next month, we're going to be hearing about planning for incapacity on October 16th from 12 to 1. The November webinar will focus on family planning. The date will be announced. All of our webinars can be found, and you can register at www.hdsa.org/ccorner. Now, I'm really pleased to turn it over to Seth J. Meyer. Seth J. Meyer is HDSA's Community Services and Resource Development Manager. He runs HDSA's National Helpline and works with HDSA support group leaders, social workers, and clinics across the country. Seth also works to develop more resources for HD and to identify more professionals. Before coming to HDSA, Seth was a healthcare integrator at New Alternatives for Children, working with families and children in the foster care system. Seth has also worked at the ARC of Monroe County and interned at FEGS and the Jewish Community Relations Council of New York. Seth received his BA from the University of Rochester and his Master's of Science in Social Work from the Columbia University School of Social Work. Now I'm thrilled to turn it over to Seth.
Thank you very much, Jane. And thank you, everyone, for coming. So today we're going to be talking, by the end of this presentation, I have 4 objectives. I hope you have a better understanding of what long-term care is. You've started thinking about what long-term care is right for you and or your loved one. You have a better idea of how to find long-term care. And you have a better idea of how to pay for long-term care. I obviously won't be able to answer everything in about an hour webinar, but I hope by the end of this you'll have the resources available. So what is long-term care? And this is something a question I get all the time. So long-term care is not just the long-term care facilities we think about, but it's a whole range of services that help someone for an extended period of time. Most long-term care isn't medical, but it's assistance helping with activities of daily living. Activities of daily living can be anywhere from brushing your teeth, showering, shaving, helping clean. Anything that helps you with your daily life. Each person with Huntington's disease will require, at the later stages of the disease, some sort of care. And the care will obviously increase and change as the person with HD progresses. Not every family is able to provide the amount of care that the people with HD may need. And one thing I always want to say is many people are able to receive a higher level of care, an excellent level of care, outside of the home. Many families get very concerned about this, but long-term care facilities and other sort of facilities are really able to provide a wonderful and varied experience. So this is a list of different types of long-term care. We are not going to get to each and every single one of them. In-home care is care in the home, and that could be anything from someone coming in to help you with your laundry and your grocery shopping to in-home nurses for 24/7 care. A skilled nursing facility, which is also known as a long-term care facility, assisted living, board and care homes, which are very loosely based and are mostly in California, group homes, which we're not going to get to, along with board and care homes, are also found very rarely found in Minnesota and a couple of states, but many of them are unable to take people with HD. Continuing care retirement communities, homemaker services, which we're going to cover in in-home cares, and programs of all-inclusive care for the elderly, PACE. There are a million other different types of long-term care. This isn't an all-inclusive list, but this is just the beginning of an idea. And some different types of long-term care have more than one name. So what's right for me? Well, there's really no answer to that because each person will require a different amount of care. And different states will have different options. As I mentioned before, board and care homes, which are available in California, aren't available in New York. So here are some important questions to ask. At what point would caring at home not be an option? Is it you may need to be working? The home may not be safe. You may have young children that you need to take care of along with your loved one. What is the line in the sand at which point, even with all of the in-home care that you can receive, being in home is just not an option anymore? And on the flip side of that, how much care can you provide for your loved one at home? And also, how much care can you provide for your loved one at a long-term care facility? What's the most appropriate thing for you and your family? What is available in my home state and around my home? Of course, everyone wants their loved one to be as close to them as possible. Unfortunately, that's not always a possibility. What is covered by my insurance, which we'll get to in a little bit with also the question of what kind of insurance do you have? And lastly, and most importantly, what can I afford? It's lovely to talk about some different types of cares, but if you can't afford it, we need to look at a realistic picture. So we're going to start with in-home care. In-home care can be anywhere from a few hours a day to 24/7 care. It's probably the most flexible of all types of long-term care that we'll discuss. And it changes and adapts to the needs of both the person with HD and the family. So if the family member all of a sudden gets a job where was working full-time, then gets a job that's part-time, they're able to care for the loved one more, the amount of in-home care can actually go down. If the person just progresses so much, the amount of in-home care can go up. They can provide help with cleaning, cooking, meals, etc., whatever's needed, and it's very flexible. The purpose of in-home care is to help the person with HD stay at home as long as possible. In-home care in the past 10 years or so has been part of a trend towards what's called aging in place. The idea is we want to move people as little as possible, and people just want to live at home. That's where their family is. That's where their friends are. So we want people to age in place as much as possible. And in-home care is a wonderful way to do it. Medicare and in-home care. So Medicare will pay for intermittent care. And this is based on Center for Medicaid Services in 2010. So part-time or intermittent care is skilled nursing care that's given on fewer than 7 days a week or less than 8 hours each day over a period of 21 days or less, with exceptions for special circumstances. So Medicare will not pay for 24/7 care, but they will pay for a considerable amount of care. To receive in-home care from Medicare, the doctor must certify that you're homebound. So if you are starting to think about in-home care, it's best to talk to your doctor about it. They can not only talk to you about what it means to be homebound, but also any in-home care programs that they've worked with that they've liked. And just to clarify, it's paid for actually Medicare Part A. Medicare has 4 parts, A, B, C, and D. In-home care is paid for by Part A. Who provides in-home care? So I want to show you a website. Just went over. Here you go. Medicare.gov, and I list the website on my slides, has a wonderful search for in-home care programs. I just did a search before the webinar started in South Dakota. It will list, and this lists 52 facility agencies in South Dakota. And then it also tells me what services they provide, basically. And if I want, I can change the county. I can also specify which service. And this allows me to compare and contrast different agencies in my area. I can also search by zip code. I searched the 10018 zip code, which is where HDSA is, and I found also quite a variety. So that's one of the, that's one of the things that really will be helpful. If you have a private insurance company, I recommend talking to them about finding appropriate in-home care. Every insurance company will be different in what they require as well as what they cover. So it's always best to talk to your private health insurance company as early as possible about what they cover and what, who they cover. Some long-term care insurance companies also provide support for in-home care for a finite period of time. Most long-term care insurance plans are for either 3 or 6 years. Sometimes you'll get one that's for about 4 years. And that 3 to 6 years is for in-home care, facilities, assisted living, everything. So you're going to want to be careful about how you use those 3 to 6 years. They also generally have a cap on how much they'll pay. So you want to be careful on how to use it, and you don't want to use it on some of the cheaper services. But if in-home care is becoming expensive and you have long-term care insurance, that is a possibility. Talk to your local social worker and your doctor to find out what agencies they've used and they've liked. And lastly, and most importantly, we can provide education and information to in-home care providers. We have a lot of resources available. Our Physician's Guide to the Management of Huntington's Disease, our online CME course, our PsychLink. Our Centers of Excellence are also willing to talk to any in-home care agency that has questions. All in all, we really provide a lot of resources to in-home care programs so they can give your loved one or you the best services possible. PACE. PACE is a relatively newer program in the past 5 years, and it's in about 15 states, but it's growing all the time. I know they just opened their first PACE branch in Wyoming relatively recently. PACE provides an integrated team of professionals to help delay or prevent a person going to skilled nursing. It's paid for by Medicaid or Medicare, so you have to have one or the other or you're going to be paying out of pocket. At this point, most long-term care insurance companies do not pay for PACE. The requirements right now, and PACE is in the process of trying to get this changed, is you have to be 55 or older, years or older. You have to live in the area where a PACE organization is, obviously. You have to be certified by the state which you are living to meet the needs of nursing home level care, which you can talk to your doctor about. And you have to be able to live safely in your community. So if you live in a 2-floor house and you can't get, and you need to be able, the bathroom's on the first floor, the kitchen's on the second floor, you really can't live there, and PACE probably wouldn't be appropriate. But if you're able to live safely in your home and in your community, then PACE may be a way to help you stay in home. And it provides a variety of services depending on what's available, but it can include things such as adult daycare, psychiatric services, nursing services, physical therapy, occupational therapy, speech therapy, whatever you need. The website paceforyou.org is an excellent resource, and they really explain what PACE is and how to locate your local PACE agency. So I definitely recommend, if you're considering a skilled nursing facility, to consider as well PACE. That's in-home care. Out-of-home care. Assisted living facilities. These are for people who can live mostly independently but require certain activities of daily living help. Mostly with like cooking or cleaning, very easy things. People in assisted living facilities tend to have their own apartment, or they share an apartment with a friend or with a loved one. Some people in mid-stage HD find assisted living useful, and I get a lot of questions from people saying, I don't need a nursing home, so I want to find an assisted living facility. I find that very few people actually end up in assisted living facilities for a couple of reasons. One, they're mostly private pay, so you're paying for it out of pocket almost completely. Some long-term care insurance companies will help pay some of the costs though. Also, by the time you find an assisted living facility, you need to move again within a few months because the Huntington's disease has progressed and the assisted living facility is no longer an appropriate place. You want to move as few times as possible because, let's be honest, moving is very stressful. It's very stressful on your loved one. It's very stressful on you. So you can always look into assisted living, and it's a great place if both you and your loved one need help with ADLs, but for the most part, I don't find it's always the best option. Continuing care retirement communities. Generally speaking, CCRC is a tiered approach. You enter into an independent living situation similar to an assisted living facility where you have your own apartment or you share an apartment with a loved one or a friend. And as you need more services and help, the CCRC is able to provide that. They have nurses on staff, they have doctors on staff, and almost all CCRCs also have a nursing home on site, which means once you're unable to live alone and you need a nursing home, you're just moved a few feet away down the hall. This allows you to be around the same friends that you made, and it allows you to stay in one place for a very long time. Now, CCRCs can be expensive. They require an entrance fee and a monthly fee, and it isn't always covered by Medicaid. There are three main types. They're called contracts. A life care, which will be the most expensive one, offers all the services that are needed for the life of the individual. A modified contract offers all the services needed for a specific length of time, how about 5 years, 10 years, 3 years, however long you guys decide. And then the contract is renegotiated at the end of that term if needed. And lastly, the fee-for-service will be the least expensive, but assisted living and nursing and skilled nursing will be added later on at a per diem rate, at a fee-for-service rate. So that will be the most expensive in the long run, but in the short run, the least expensive. CCRCs are popping up all over. I know from personal experience that they're really wonderful if you can find a good one in your area, but they aren't for everyone. And as they do continue to grow, we're going to be seeing a lot more information on these. Long-term care facilities. Long-term care facilities are really the best known of all the long-term care options. And this is probably what I get the most questions about. It can be difficult to find an appropriate facility that accepts a person with Huntington's disease, especially if the person with Huntington's disease has a major psychiatric issue or requires a locked unit, either because of the psychiatric issue or the cognitive issue. If the person with HD just wanders a bit and may wander, not pay attention, and may wander either off unit or off-site, a locked unit might be necessary. Now, in 2004, and these were the most recent stats I could find, there were only 16,000 long-term care facilities and 1.7 million beds available in America. While that may sound like a lot, it really isn't. We have more and more we have the baby boomer generation who's coming up who are going to start needing long-term care facilities. These beds are highly valued, and they get filled up very, very quickly, especially in some of the better facilities. So there really aren't a lot of beds. And that makes it harder for people with HD to find beds because some long-term care facilities just want the easy, quick ones, quick people. And Huntington's disease can be a little bit more work and staffing. Also, some long-term care facilities have a lot of misconceptions about what Huntington's disease is and what it looks like. And to kind of battle against these misconceptions, our social workers can provide free in-service trainings for facilities. We have social workers all around the country, and they're really excited to do these in-service trainings. And if there is no social worker in your area, I do the in-service trainings via webinar, which allows them as well to save the in-service training and provide it on a later date to new staff. Our physician's guide is also available for the medical team. A lot of medical teams really appreciate our physician's guide, our continuing medical education course, all of these resources. And I find that once a facility finds out what's available for them to learn about Huntington's disease, they're a lot more willing and interested to accept people with HD. One of the biggest concerns I also hear is the facility is not used to taking younger people. And if the person with HD is 40 or 50, the generation gap between them and the 80, 90-year-old can be intimidating for the long-term care facility. We have a lot of ways to help the long-term care facility work with that generational gap and help make the facility and the person with HD really comfortable. So there's a lot available. So the most important thing is to plan ahead. You can't start planning too early when it comes to long-term care. There are a lot of decisions that need to be made, and those decisions need to be made, or if those decisions are made earlier, you're avoiding having a heartache and rushing around later, especially when rushing around, you may not be able to get the resources you need for your loved one, where if you plan ahead, you'll have everything in motion if and when an emergency happens. Advanced planning is very important. We actually have a new family guide series on advanced planning, which can be downloaded on the HDSA website at www.hdsa.org, or you can order it from the national office. So I recommend every person read the advanced planning book. So you want to start having early and often conversations about what your loved one wants in long-term care and what your loved one wants concerning end-of-life care. Now, you want to try to not make unreasonable promises. Saying that you'll never put your loved one in a long-term care facility may actually be an unreasonable promise, because then either you're going to have to break that promise and put your loved one in a long-term care facility, or you may have to keep that person at home to the detriment of your health and your family's health. So while you don't want to say, I'll never put you in a long-term care facility, you can say something along the lines of, we'll try really hard to keep you at home as long as possible, as long as it's healthy and safe for everyone. What the person with HD wants may not be feasible. The person with HD may not be aware that they have Huntington's disease, and they may just, want to stay home. That may not be a feasible, realistic option. And what the loved one you may want also may not be feasible. You, of course, will want your loved one at home, and your loved one may not be able to stay at home. Have the person with Huntington's disease look at long-term care facilities early in the disease so they can be part of the process. Exploring long-term care facilities early on helps the long-term care facility, as well as the person with HD, feel more comfortable. Some facilities even have the option of adult day programs at the facility, so that way the person with HD and the staff become a lot more familiar with your loved one and with Huntington's disease than when your loved one, requires long-term care. The facility knows you, you know them. Once a bed is open, it makes life so much easier. Paying. And this is really where a lot of issues come up. Medicare will not pay for long-term care. What Medicare will pay for is 80 days of skilled nursing at a skilled nursing facility after a hospitalization after your first 20 days in the facility. So you'll have basically up to 100 days in a rehab facility, but the first 20 days you'll have to pay for, and then they'll pay for up to the next 80 days. Medicaid generally covers long-term care to some extent. And in 2011, Medicaid spent $136 billion on long-term care services. So getting on the state Medicaid is useful, but not always an easy route to go. Long-term care insurance will cover about 3 to 6 years of long-term care services, depending on the plan. Each plan and company will cover a different amount of the service cost. Long-term care insurance, generally speaking, doesn't end up paying for the whole thing, and you'll have to pay out of pocket for those 3 to 6 years. The hope is that eventually, after those 3 to 6 years, you'll actually be eligible for Medicaid, and then you'll be able to have Medicaid pay for your long-term care once your long-term care insurance has been depleted. What a lot of people actually also don't know is life insurance can be cashed in early to help pay for long-term care. Now, longtermcare.gov is an excellent resource which provides a lot of basic information. And over here on the left is information on costs and how to pay. And over here it talks about long-term care insurance, health and disability insurance, and paying privately, but also a little bit more information about life insurance, using life insurance to pay for long-term care. I'm not going to get too much into this because there are a lot of different things to use this for, but it's definitely something, if you have life insurance, to look into. This also goes back into planning ahead. Long-term care insurance and life insurance are more difficult to get and nearly impossible if you test positive for Huntington's disease. The Genetic Information Non-Discrimination Act, which prevents discrimination in health insurance and employment, does not cover long-term care insurance and disability insurance and life insurance. So if you haven't tested already, these are 3 things you want to look into before you test. They're very important, and before you get a diagnosis of Huntington's disease. Many people do get these programs, and I cannot make a recommendation whether or not to get one of these, but I highly recommend researching. And what's available in each state will be different. And when you're looking at long-term care insurance policies, you'll of course want to get an idea of what costs are in your state and how inflation will affect your long-term care policy. Lastly, savings and investments. There was recently a webinar, I think 2 months ago, on saving and financial planning. I recommend everyone watch that or re-watch that. The long-term care costs a lot of money, even when you have long-term care insurance, and sometimes even when you have Medicaid. It is very important to start saving up early, look at investments, talk with a financial planner to make sure that you and your loved one have the money available when the time comes. So saving and investing is something really important to utilize. So resources. The purpose of this webinar is really to provide you with a very basic introduction to what long-term care is. I could spend an hour talking about each one of these types of long-term care facilities and programs, but really the most important thing is for you to become a little bit more familiar so you have a better idea of what's the best for you and your loved one. And then to have the resources to find more information so you can find what's available in your state and in your community. Every state is going to have a different amount available. Some more rural areas are going to obviously have less available in terms of long-term care facilities than more urban areas. So the resources is really important for you to kind of find what's available in your home state and your home community. I will say this once, I'll say this a million times. Connecting with your local social worker is the best thing to do. At hdsa.org/SW, we have a map, and it shows where it has almost every state filled with the social worker covering that state. It may take a little time. The social worker may need to do a little digging into your area, but they can generally recommend places. They are always willing and interested in providing in-service trainings. If you can't find your local social worker, you can also email hdsainfo@hdsa.org or call the HDSA helpline at 888-HDSA-506. We can provide very basic information. And just to let you know, the HDSA helpline, it goes to me. And if I'm not in, it goes to either my colleagues Jane Kogan or Ann Lesserman, who are also both excellent social workers. The same is with HDSAinfo@hdsa.org. It generally goes to me. If I'm not in, it goes to Ann or Jane, and there's always someone who will answer within one business day. Please note the HDSA office is only open 9 a.m. to 5 p.m. Eastern Standard Time, Monday to Friday. We can help connect you to your local social worker, but always the local resources are always the best because we cover the whole country. Your local social worker covers your state or your states. Lastly, we have several HDSA publications that a lot of family members find useful. Long-Term Care Family Guide is available for free to download, or you can request a copy you can email hdsainfo@hdsa.org to request a copy. And that provides a lot of information about long-term care. Past issues of the marker and We Are HDSA, especially We Are HDSA in August 2011. August 2011 actually was fully dedicated to long-term care. We don't have many of the markers or We Are HDSA in office, but we do have these available on our HDSA website, free for download. Under hdsa.org/publications, we have what's called the HDSA Article Connect. The HDSA Article Connect has a listing of all of the past articles listed by category. Here are some other resources that are available. They aren't necessarily HDSA, but they are really wonderful resources. I showed you briefly longtermcare.gov, and this was provided by the U.S. Department of Health and Human Services website on long-term care. It provides a lot of great information and a lot of easy-to-understand information. And one of the problems I've always found with a lot of long-term websites is just understanding the information, because it can sometimes be really confusing. For me as a professional, and I've been working with long-term care and long-term care facilities for a bit now, even I find some of the double talk confusing. Medicare.gov/quality care finders. This is a way to find information on facilities and compare different institutions. And they have the ability to search by what services you need, by state, by county, and by zip code. If you're living in a more rural area, you're going to want to probably search by state. And you're going to want to really, and if you're a more urban area, you may be able to search by zip code. But you really want to make your search as wide as possible because you want to be able, not every facility will be willing to take someone with Huntington's disease. In-home care programs are a little bit more flexible, in my experience. Seniorhomes.com. It's a free resource for finding long-term care facilities and a lot of different types of homes for seniors and people with disabilities. It's a really wonderful resource, and again, it's really easy to use. Carepathways.com, that's a company that was started by a nurse, and the point of it was to provide long-term care. They do have a shop section as well, but they also have a lot of great free information. So I really recommend looking at this. And lastly, payingforseniorcare.com. And this provides resources for financial assistance in paying for long-term care. Even though it says it's called payingforseniorcare.com, don't be concerned about the title. Senior care is just another way of saying long-term care. So you want to look at senior care, even if your loved one or you're 40 or 50 or even 30. Senior care is still the appropriate route. So I'm going to now open it up to questions. I cannot answer a specific question about local resources, about your personal person. Also, if I do not get to your question, please send me an email or call me. smeyer@hdsa.org or 888-HDSA-506. If you call me, just please leave a message, and I'll get either myself or someone else. We'll get back to you within 1 business day. And of course, I'm available by email during normal business hours. And I'm happy always to talk to you and to explore if there's one particular area that you want. But I also encourage you to ask questions about anything in long-term care that specifically is pertinent to you in general. So, back to you, Jane. I guess I'm going to...
Great, thanks. So now just send your questions over, and Seth will be taking questions as he gets them. And just as a reminder to ask your question, just type it in to the question panel and hit send.
And while I'm waiting, I really want to really say thank you all for taking part in it. Wow, I'm getting a lot of questions. All right, so the first question is, can you clarify homebound? Not driving, but ambulatory. Homebound is actually going to depend regionally. So I live in New York. So some people who can't drive but may be able to walk a couple of blocks away wouldn't, so they can go to the local store, they can go to the local drugstore, and then take a taxi the rest of the time. They wouldn't be considered homebound. But someone who maybe is living in very far away from a lot of programs, they would be considered homebound. So it's really, homebound is you cannot safely get to local services and supports easily without a lot of help. But it's going to depend differently. You definitely need to talk to your doctor, though, because you really do need a doctor's note saying that you're homebound. Can you get long-term care insurance after being diagnosed with Huntington's disease? Probably not. If you're already diagnosed with Huntington's disease, try. If you want long-term care insurance, you are probably going to be denied, but it's always, if you want to get long-term care insurance, it's always best to at least try. It is very difficult. Who do I contact to get a free in-service training for our staff? Pop me an email if you want a free in-service training. Either go to hdsa.org/SW to find your local social worker, or just email me. I'm really happy to connect you to whomever is your local social worker, as well as send you free information. Also, our local social workers are excited to send whatever information we have that's appropriate. And we have everything from a fast fax, which helps CNAs, which may work only intermittently with your loved one, to the doctors who work very intimately. Are you familiar with community Medicaid programs? To receive Medicaid services at home is a precursor to Medicaid for long-term care. Community Medicaid programs I'm not going to get into because they are really, really specialized, and each one is going to be different. What I recommend, Medicaid will cover, generally speaking, the same things across states, but then each state will have different types, other things that might be covered. B, will pay a different reimbursement rate. So, for example, New York has actually a higher reimbursement rate than Massachusetts. And also, they'll cover different things. They'll be different. And how to get Medicaid is going to be very different. Your income level is going to be different. Your asset level is different. Some programs do count your primary residence if you own it as part of your assets. Some don't. And then also the look back. How long, to make sure that you didn't just put away your money in a trust, they'll have a 3 to 5 year look back for Medicaid. And so with in New York, it happens to be 5 years. Every state is a little bit different, though. So for information, that's a very long answer to your question, but for information on your community Medicaid program, I recommend talking to your local social worker, or you can contact me and tell me which community you live in and where you live, and I can connect you with information on what's available in your state and which social workers are available in your state. All right, next one. All right, so several people in our community are concerned about getting long-term care because they ask about your health history. Now, I'm assuming we're talking about long-term care insurance. Long-term care insurance, you need to answer every question they ask, and you have to answer every question honestly. They're going to ask about your family history. And if they ask, do you have any genetic diseases in your family, you have to say yes. Then they may ask you, well, what diseases? And then you have to say Huntington's disease. You have to be incredibly honest. If you are not honest and they find out that you lied, they will take away your long-term care insurance, and you will not get the money you paid in back. It is kind of terrifying, but if you answer honestly and only answer the questions they ask, so if they don't ask, at what age do your family members normally start getting symptoms of Huntington's disease, then you don't have to tell them, well, it generally happens at age 20. You only have to answer the questions they ask. So that's with long-term care insurance. With general long-term care, long-term care facilities are very used to treating and helping people who have difficulties. And it's perfectly normal. They'll definitely be a little bit concerned sometimes with taking in someone with Huntington's disease if they've never had someone with HD before. So that's why we always recommend if you're working with a long-term care facility, just have them connect with our with your local HDSA social worker. Have them connect with me. We'll send them information. We'll make them feel a lot more comfortable. All right. Good information. Thank you. Okay. Someone who is living entirely on disability who does not have Medicare, but no other resources. My first recommendation is talk to your local social worker. If you're just living on disability and you have no other resources, you may be able to get Medicaid. So I would recommend talking to your local social worker about what state resources are available. There is that 2-year waiting period. Once you get disability, there's a 2-year waiting period before you can get Medicare. But and we're working on trying to get rid of that with the HD Parity Act. If you have any questions about the HD Parity Act, just send me an email or send an email to HDSA Info, and we'll forward it on to Jane Kogan, who runs the Caregivers Corner webinar and who also does all of our advocacy stuff. But I would definitely recommend at that point talking to your local social worker about what state resources are available and if you would be able to get Medicaid, which a lot of people find very, very useful. All right. I stated Medicare will cover up to 21 days of in-home care. Is that per year? Okay. I just want to clarify that, and I want to actually remind myself what slide that is. I'm going to go back to that slide. And while I'm doing that, I just saw, what about hospice care? Hospice care is covered completely differently, and you don't need Medicaid or Medicare. Medicare will cover hospice care, even if you don't have Medicare. All right, so this is the slide, and it basically says that it will cover intermittent skills on 7 days a week or less than 8 hours a day over 21 days or less. My understanding of that has always been, based on my conversations with Medicare professionals, is that you only need it for 7 days or less than 8-hour days every 21 days. So every 21 days or less, every 21 days, it then gets another 21 days where you need 7 days of in-home care or 8 hours a day or less. It's basically to make sure that you're not requiring 24/7 care. So it's not a 21-day maximum. Sorry for that confusion. And while I'm waiting for more questions, I just answered about hospice care. I always recommend people talk with their doctors about hospice care, which is hospice care is end-of-life care. It's generally the last 6 months of life, but sometimes with Huntington's disease, it's hard to really tell what the last 6 months of life may be, and it can be renewed every 6 months if the doctors feel that the person is at their end of life. And it provides a lot of just end-of-life care, end-of-life support, both for the person with HD and their family. I highly recommend talking to your doctor about that when you're a little bit concerned. But that is actually covered through something completely different in Medicaid. Sorry, Medicare. We have done a webinar on palliative care, and that can be found at our Caregivers Corner webinar website, which is www.hdsa.org/ccorner. And that's where you can find information about our webinars on palliative care, on estate planning, as well as on advanced planning for Huntington's disease. All of the webinars are also on the HDSA Article Connect on the HDSA Publications section of the website. So they're all listed there. Any other questions?
I don't actually think we have any, Seth. I think
Okay.
that we are at the end of the questions. So thank you very much. Thank you to everybody who attended. Please don't forget to fill out your evaluation and give us feedback so that we can continue to bring you these webinars and expand our topics.
Great, and thank you very much, and have a nice day, everyone.
Thank you.